So I'm going to talk to you about three conditions that you'd likely come up as a PT. So the first one I'm going to talk about is blood pressure. The second one is going to be a lower back pain, and lastly we're going to talk about a knee injury. So with high blood pressure, this is when your blood pressure is over 140 over 90, so systolic and diastolic. This happens through, a couple of causes are through bad dieting, and also as you get older, your blood pressure will go up. So you'll see this in older clients as well. During exercise, ways that are going to inform you that something's happening because of that high blood pressure will be a fast or irregular heartbeat. You're going to have shallow breaths, or you could have a weak pulse if you're feeling their pulse, or they could feel dizzy. To get around that, you're always going to want to get them to see a doctor first and get the medical clearance and any guidance that they can give you on how to perform exercise. But as a general guide, I would start them off at a very light intensity and slowly build into the intensity in both cardio and weights, and then progress from there. So the next problem that you're likely to come across is lower back pain. This is in the lower back, so around the L1 to L5. This can be it'll just be pain and discomfort in that area. It can also refer down whichever side it's on, down your leg, and this could be a bit of nerve problems. This is also known as lordosis if they've got a little bit of a arch in their pelvis is tilting forward and their spine isn't properly curved, or in the normal curve I should say. Ways you will know in exercise when they have problems, that they will feel pain at the site, or they can feel pain at the site, or it can also, like I said before, shoot down the leg, because it could be nerves, or it could be a nerve, or they can have tingles in their leg. What would I do for exercise? First of all, I'd get them to see a physio and then get any recommendations from them. After that, or as a general guide, I would be sticking away from any free weights, which is putting a lot of pressure through their spine and possibly forcing them out of a neutral spine. So you can still do weights in the lower body though. You just want to use machines which aren't loading their spine, and you want to also help build up their core muscles. And finally, a knee injury. This can be a problem with the joint itself. Could be tendons, could be ligaments, or it could be the muscles around it which are contributing to the pain in the knee. You're going to have to see a physio to get a better diagnostic on it. During training, they will have pain there, and that's when you want them to get them to stop. Or if they come to you later and say, look, I've got pain from that session, you know that you're going to have to refer them on and alter their sessions. The way you're going to have to alter their sessions is you're going to have to alter their load through their knee. So that means you're not going to be able to do as high impact through their knees. So that will probably mean cutting out most squats and deadlifts, lunges, etc. for weight. And then the big one for cardio would be the running. But you can still do low impact like swimming or cycling, and with weights just do more predominantly upper body program.